Hi, I'm Dr. Tim Young, and we're going to talk about Sever's disease, or Calcaneal Apophysitis. I work at Isco Foot and Ankle, and we see a lot of kids with heel pain. So Sever's disease is a problem of the growth plate with children, and it affects the heel. The growth plate on the heel bone, or the calcaneus, is on the back here, and the island of bone that's separated by the cartilage growth plate, this island of bone is called the apophyseal plate. And the section of cartilage that separates the two is called the fasciitis plate. A lot of this is on our website also, on a blog on Sever's disease. So the anatomy again shows where this bone is, this island of bone, the apophyseal plate. And on the one end, you've got the Achilles tendon pulling up, causing traction on it. And then on the other end, you've got the plantar fascia. So I could just draw this in. We've got the heel, the growth plate right here, and then the apophyseal plate right here. And then you've got the plantar fascia pulling this way, and then you've got the Achilles tendon pulling up this way. And so the causes of this include that mechanical traction on that island of bone, but also impact, because when they're doing sports like soccer, gymnastics, football, or just playing, they're going to get a lot of impact, and half the time they're on concrete, half the time they're barefoot, half the time they're wearing shoes, but the cleat might hit in just the wrong spot. So there's a number of different causes of it, but it's a vulnerable area to begin with. Other potential causes of this are just the foot type itself. Some kids have a really high arch foot structure, and because it's really high arched, they're going to hit the ground at a really steep angle, and there'll be a lot of impact. Then other kids have a really flat foot, and they're going to have a lot of tension within this plantar fascia. So there's a couple different reasons why different foot types might be prone to it, but it seems that no foot type is immune from getting this. It's very common in kids. And as far as the age the kids get it, boys are going to get it. It's going to depend on when the growth plate is open, but typically I'll see this about, the earliest would be 7 to 8 years of age, and then up until about 15 with boys. And then with girls, it's going to be over with sooner because their growth plate closes sooner. So with girls, it might be done by, let's say, 12 or at the most 13 years of age. And so what's going to happen is after your child is done playing sports on the ride home, they're going to say, gee, my heel's really hurting. And sometimes it gets so bad they have to limp around. And sometimes you're thinking it's just a bruise, and sometimes that is all it is, and it goes away. But if it's something that keeps going on, and after a few weeks it's getting worse, and they're not able to really play the sport they're in, then you know what they've got. Well, you don't know, but you can come into our office and we can take an x-ray. On the x-ray, we're going to see the growth plate, and then we'll see a lot of times there's an increased density of bone here on this apophyseal plate of bone. So the x-ray can help with the diagnosis. Once you got your diagnosis, then you've got to figure out how you're going to treat it. And at our clinic, a lot of times with the really mild cases, before they come in, you can do resting it, you can ice it, have them avoid going barefoot, have them wear really good athletic shoes, don't go around the house barefoot, that's very helpful. And you can go to the store and buy a heel cup. Sometimes you can get this is a medical grade one, but you can just buy an inexpensive heel cup, and sometimes that's all it takes. You can buy an over-the-counter insert for it. And like I mentioned, you can also ice that area, like on the drive home after picking the kids up from their sport or their practice. But if it's really tough and it's not going away and you come into our office, the best long-term treatment for a really bad Sever's disease is orthotics, the prescription orthotics made from a cast of the foot. That's one of my favorite long-term treatments because it treats the mechanics of what really caused the problem. Other things we can do if it's really bad, we can have them use a night splint also to stretch out the calf muscle so there's less pull of the Achilles tendon, less traction on that island of bone. And another thing that's very helpful is to stretch it. They can just do a typical wall stretch where they lean up like this, or they can even get a Pro Stretch device and stretch it out and get a really good stretch on the calf muscle. It's hard to get kids to remember stretching. But the good news is this is something that they will outgrow. But if your child is in a lot of pain, they're not able to do their sport, bring them in. We'll get them better.